So I'm going to talk about medico-legal situations in ER. So first, I'm going to talk about what are the most common medico-legal cases which come in ER. They are trauma, poisoning cases, and suicidal attempts or completed suicide. So we are just going to talk about the medical legality about each of these cases. First, trauma. The primary objective is identifying a medico-legal case as a trauma case. That is there trauma? Is there injury or is there a wound on the person's body? Now, what is an injury? Injury is defined in section IPC 44 of IPC. It's very important to know about that because it says any damage to mind, body, property or reputation of a person. So, of course, property and reputation won't be coming to us. It will directly go to the police station, but mind and body will certainly come to us, to a doctor. It will come to the ER. So, according to this section, even if a person has got a mental trauma caused by someone else, it becomes a medico-legal case. It has happened before also. In our ER also, a person had come with chest pain he developed because the neighbor shouted at him, and we had to make it a medico-legal case, and we even intimated that case to the police because it comes under injury. The next thing is wound. Now, when we discuss about wound, it's medically speaking, wound is nothing but a physical damage, or there is a discontinuity. Medically, when there is a discontinuity in the tissues, we call it as a wound. Okay, now there is another term which legally, wound is not a legal term, it's a medical term. Now, legally there is a term known as hurt. What is hurt? Hurt is legally defined in 319 of IPC. 319 says any disease, damage, pain or infirmity caused to the human body, that's hurt. Again, this becomes a medico-legal issue. Now coming to the documentation of these, first you have identified a medico-legal case, and after which you have to document it. Now, what all you do under documentation, we are not going to go into depth of the documentation because the time won't permit, but you have to write it down in detail for the sake of wound certification. Okay, including who brought the case, the identification marks, what happened, the detailed history. You have to note down all the injuries on the body, because all these things will aid in a wound certification. It will further help in his further judicial proceedings. It will help in maybe criminal or civil. It will help him in that. The next step. So first we identify the case, then the documentation process, then the next step, which is important, is intimation to the police. Now, intimation to the police of offences are dealt in section 39 of CRPC. That's a citizen to inform certain cases to the police officer. So that's police intimation. So in a case of assault or a trauma case also, you do police intimation. So that's according to section 39 of CRPC. Next common kind of case which you will encounter in ER is going to be poisoning cases. Now, there are basically three types of poisoning cases which can come to you: suicidal, homicidal and accidental. The first thing is, of course, identifying the type of poisoning, as the types have been enumerated on the top, is done by patient history, and if there is a suspicion from the part of the treating physician also. You have to take a detailed history, ask him what led him to consume this poison, or was it forcefully administered to him, or it's accidental. And if at all there is a suspicion, of course, you have to directly, will come to it, we have to intimate. Now, medico-legal duties of a physician in case of poisoning cases, what all you have to do: a detailed history taking, as told before, to ascertain the nature of ingestion, whether it is suicidal, accidental or homicidal in nature. Collection of material evidence is very important for toxicological analysis. Then only the treatment part can be done. Not only that, medico-legally also it becomes very important that the nature of poison, what it is. The evidences which you collect are usually blood, urine, clothing articles. These are blood and urine itself is more than enough. Clothing articles for judicial case, for medico-legal proceedings, that might be necessary. So you have to always preserve the clothes if at all there is a spill. Now coming to the third step, that is intimation to the police. Whether or not to intimate, I'll tell you the circumstances. In all cases where the person is unconscious, because you don't know, you cannot take a history, and you cannot completely rely on the patient's bystander's history. So what you need to do is, you have to, if the patient is unresponsive, if the patient is unconscious, certainly yes, you will have to intimate it to the police. And of course, in homicidal administration, there is no doubt about it, you have to, if the patient gives you a history that it was a homicidal, a forceful administration, then you have to intimate it to the police. Accidental ingestion also, because you don't know the intention, you don't know whether it was swabbed, some material was swabbed for something, some toxic material. So in accidental ingestion also, it's safe always to intimate it to the police. Then comes again suspicion from the part of the physician that the history is conflicting, maybe the history of the bystander and the patient is conflicting, or the patient himself or herself is keeping on changing the history. In those circumstances again, or you have a suspicion that this history is not reliable, or the patient is giving is not quite reliable, in those cases also you have to intimate the particular case to the police. Now coming to the scenarios of suicides. Different scenarios, that is, I will be elaborating the different scenarios. Patient coming conscious with attempted suicide, patient coming unconscious, the patient is unconscious on arrival, then the patient is dead on arrival. Okay, these are three situations usually you will be encountering when cases of suicides come. What are the medico-legal duties? First is, like any other medico-legal case, documentation. Medico-legal documentation has to be done. Then evidence preservation, just like we saw in poisoning, evidence preservation should be done. Then comes intimation to the police. Briefly, I will go through each of these points. First, medico-legal documentation. This should include, if possible, a dying declaration. Only when the patient says or declares that his present condition or the imminent death. The present condition, what I mean is that he is facing a situation of imminent death, and this condition has been perpetuated, or it is led by some other person. Okay, his present condition of imminent death has been led by some other person. In that situation, it's not only in case of poisoning, please don't confuse, it can be anything, it can be due to anything, that his present condition is of imminent death is led by some other person. In that case, a dying declaration can be noted down, and that becomes a crucial kind of evidence. Okay, even if the patient survives, it has got a corroborative value. It's not completely null and void, it has a corroborative value, but certainly if he dies, it has got a great evidentiary value. Evidence preservation. In case of poisoning, the articles discussed under that is suicide by poisoning. Okay, then the articles discussed under the heading of poisoning, which we already have discussed, like clothes, blood, urine, all these things have to be preserved for analysis. Now, in case of hanging, often, if possible, that is, I am not saying if the patient is conscious, alert and coming, do preserve the ligature material and continue treating. No, you can't do that. That's out of common sense. So, if the patient is brought dead with the ligature material, you are sure, for example, there is rigor mortis in the patient, you already know that there is no hope of reviving this patient. In that case, the best thing to do is that do not fiddle with anything, do not manipulate anything, don't remove anything, don't untie anything, don't cut anything, just preserve all those evidentiary material, just preserve that. If there is a ligature on the neck, preserve that ligature material and just intimate the police. Now coming to police intimation in cases of suicide or suicide attempts, whether it needs to be intimated. All cases of suicides where the patient is dead on arrival, he is already dead, unconscious, accidental or homicidal in nature, should be intimated to the police. So the question is that what happens to people who are survivors, that is coming to the ER, have consumed some poison or by any other means they have attempted suicide. What about them? About them, as per the Amendment of Mental Health Act in 2017, Act number 115 says that suicides, it directly does not say need not be intimated, but they say that a person trying to commit suicide is under great mental stress and strain, which itself is a mental disease. So he needs to be counseled, he needs to be treated, he needs to be given psychiatric help rather than going and intimating him to the police or taking a case against him. So that's a new act. And the old one, 309 of IPC, which stated that trying to commit suicide is attempted suicide is a criminal offense, and they could be even charged for with 1 year of imprisonment. But as we know that according to the new act, it's a mental disease, so they need to be treated rather than being incarcerated. So with that I end. This was brief overview of the medico-legal situations in ER. So thanks a lot for your patient listening.